on, guys? It's Shane, also known as the Pittsburgh PA. I'm here today with a very special guest, the PA Patrick, world traveler, dancing PA, does it all. Patrick, how are you doing today, man?
I'm doing great. I'm so excited to talk to you and to spread the word about the PA profession and share a little bit of my insight to all the PA listeners and all the listeners out there.
Absolutely, man. And so I appreciate you coming on. I kind of gave you a little mini introduction, but I really want you to introduce yourself to the people who don't know you, kind of what field you're in, what specialty you're in, and kind of what you're up to these days.
Yeah. So what's up, you guys? My name is Patrick Nguyen, also known as PA Patrick. So a little bit about me. I work in plastic surgery. I've been doing it for the past year or so. Before that, I was actually doing general surgery. I've been doing that for 3 years. And so in total, around 4 years of PA experience. On my free time, I love to swim. I go to the gym. I was also a child actor. And so I act and I dance. And so that's why in my TikTok, I kind of bring in some dancing into there just to mix it up and have some fun.
That's awesome. I actually didn't know that you were a child actor. Like, that's such a fun fact. That's so cool.
It
That's
is, it is.
wow. Okay. So to go from child actor to medicine is a big jump, right? What kind of
Yes.
got you involved in the medical field, and then more specifically becoming a physician associate? What kind of moved you in that direction?
Okay, wow. So we're just gonna start from the very beginning then. So, when I was younger, I always had a passion of storytelling. I think as a child, I was always watching movies and trying to reenact it. I would, back in my time, we would grab the camera, the physical camera, and like film and make home movies. And so my parents always saw that side of me. And so that's when I asked them, hey, I want to try to give this child acting a shot. And so luckily enough, my parents were actually, very supportive. And so they actually helped me get into the acting business. I did auditions. I had a manager. I was with an agency.
Wow.
I did a couple commercials actually, and so we can dive into that later if you have questions about that. But after that, I realized that this is not sustainable. Back in the day, there weren't a lot of Asian roles, to be honest. There weren't a lot of diversity in Hollywood. There still isn't enough diversity, but um, still, I was trying to pursue it and it didn't seem like it was going anywhere. And so, you know what? I realized that, hey, I actually really like science. In high school, I really like anatomy. I was curious about the bones, the muscles. And so because of that, I was like, you know what? Let's try to make this a profession. Let's try to make a job out of this. And so with my research, I researched, hey, there's actually this profession out there called a PA, a physician assistant, or as we call physician associate. And so I looked into it. I fell in love with the profession and I was like, you know what? Let's try to pursue this. And so I entered college with the mindset of, hey, I want to become a PA and nothing's going to steer me away. So from the beginning, I knew I was going to be a PA. And then through hard work, through college, through all my schooling, I finally got to achieving my goal. And so now I'm here today.
That's awesome. I mean, you can see it and it kinda all makes sense now, I feel like. I feel like your personality is kind of, demonstrated through your videos. It's infectious, you know? I always when I go onto my feed, I always see you pop up, and I'm always like, "Oh, there's Patrick," you know? And
Oh, thanks.
it's awesome. It is
Yes.
really awesome. And so, you kind of mentioned that you had started in general surgery. So we kind of established physician associate, we were a Hollywood actor, decided to pivot kind of, and now we're in plastic surgery. How's that been? What is that like? That's a little bit different from general. You didn't like the gallbladders or what was going on?
So I love the galls. I love the gallbladders, the appendixes, the colon. I'm all here for it. Um, and so what happened was I actually was in general surgery and I loved it, but it was time for me to expand um, my mindset and learn something new. Um, Not that I felt stuck, but I felt like, you know what, I feel like I could do more. And so because of that, I looked into plastic surgery because yes, it's a different field, but it's kind of in the same tree branch, right? Surgery, plastic surgery. We're still in the OR. We're still, operating on patients. And so I was like, you know what, let's give this plastic surgery um, job a shot. And so it was just my luck that another doctor that was starting his own practice, he was actually looking for a PA. And so I was like, you know what? Let's go over there and talk to him about it. And when I talked to him, I wasn't actually looking for a job. I was just wanting to hear what the differences are. What's the differences between general surgery and plastic surgery? Um, and he really sold me on it. And so because of that, I built a good relationship with him. And at a certain point, it felt right for me to leave my general surgery job and go over to plastic surgery. And so when I left general surgery, yes, it was hard, but I left on a good note. I still have great connections over there. And then when I went over to plastic surgery, yes, it was definitely a very, very, very big learning curve.
Uh,
Um, but I got a great doctor that I work with. He's a great preceptor. He's been teaching me everything. And so now I work in plastic surgery.
no, that's awesome. And I think
Yeah.
that there's a lot of value that you can add too, because me and you both have. Is this your second job then that you've been on?
Yes, my second job.
Yeah, so we've both transitioned to a different job where I was in primary
Yes.
care going to the hospital side of things. And so like, can
Right.
you kind of just touch on what it's like to change jobs? Because I think there's probably a lot of people that follow us and they're like, "Hey, I'm thinking about leaving, but I'm scared,
Yeah.
I'm not comfortable." What was your experience changing jobs?
So like I said before, it was difficult to leave my general surgery job because I'll tell you this, I hear a lot of friends leaving a job because of negative reasons. It could be XYZ, this was wrong, this was bad, I didn't feel comfortable. But I left on good terms. There was actually nothing wrong. There was
Yeah.
nothing wrong. There's no bad blood. It was just that I felt like I wanted to grow. And so,
Yeah.
yes, leaving was hard, but at the end of the day, I wanted to do what was good for myself. And that was, ultimately learning something new. So yeah, it was difficult. It was difficult.
Yeah, and I think that, like, that's a great point that doesn't always have to have this, like, negative, like, connotation to it, right?
Right.
Like, it doesn't always have to
Right.
be on bad terms, and truthfully, I think, it's better to have those connections still because anywhere you go in medicine, references, things like that are so important.
Right.
Um Speaking of negative connotations, I think that this is something that a lot of people kind of get wrong from plastic surgery. I know that people in the medical field particularly appreciate you guys and know that you guys are much more than the misconceptions, the misnomers. But can you like speak to like that, negative connotation that sometimes comes with plastic surgery? Oh, they've had plastics done. And can you just expand upon the field? Because we know it's much more than just the cosmetic things that you guys do, even though that stuff is important.
Yes. So yeah, I think the misconception when you hear plastic surgery is ultimately people always think of beauty and appearance, which one aspect, yes, it is, but on the other aspect, sometimes it is medically necessary in the sense of this. Um, we do a lot of weight loss surgery in the sense of we have patients that have already gone through bariatric surgery, and now there's just so much extra skin, extra fat on the body, and it's hard for these patients to function. Um, Especially during the summer right now, I have a lot of patients where they come in and it's hard for them to exercise. It's hard for them to wear clothes because there's sweat marks and rashes. And so, because of that, they do need the surgery because if we just have loose skin hanging over our bodies, infections can occur in between the skin folds. And so, because of that, sometimes plastic surgery is medically necessary. And that's just one example. There's tons of other examples, but yeah, I think that's the one misconception.
Yeah, and I appreciate you speaking to that because, like, in my experience as a hospitalist, I've consulted with plastics before for like traumatic accidents, things like that. Um, Anything like with involving like skull fractures, even like
Right.
crazy stuff that people have done, 3D printing like pieces of
Yes.
skull.
Yes.
It's amazing, right? And I think
Yes.
that people maybe even in the community, in the medical community, but especially outside of the community, think of plastic surgery as like the movie stars and this cosmetic thing, but it's
Right. Yes.
so much more than that. And once you
Exactly.
really see what you guys are doing, it's mind blowing. Seriously. So kudos to you guys because I don't think you get your
Thank you.
flowers.
Thank you.
Yeah,
Thank you.
absolutely. So, me and you have very different jobs, but I can kind of go over my job, but I want to hear about you if I was a PA student, right? Because a lot of
Mhm.
our followers are PA students and they want to
Yes,
know
that's
what
true.
they always want to know what it's like. What is it like to do this or do this? Because they're thinking about jobs. What is it like for you in a day being in a plastic surgery setting? What does that look like as a PA?
Yes. So my schedule is Monday through Friday. So Monday and Wednesday, those are my clinic days. And so that's when I'll see patients in the office. This is my moment when I will check on any pre ops, any post ops, and any new patients. So if we want to break it down real quick, patients come in for a consultation, right? We can assess them, see what they need help with. And then that's when we will decide if they need surgery or not. So that's one patient. The next thing that we would check on is for pre-ops. We want to make sure that they have a cardiac clearance, making sure that their blood work is done. And then the third aspect is the post-ops. So making sure the wounds are healing correctly, making sure the drains are draining. And so those are the patients I see on my clinic days. And then Tuesday, Thursday, Friday, that's when I'll be in the OR. I'll be assisting the surgeon. And as a PA, you do have the power of being the first assist. And so you and the surgeon are working together, operating on the patient. I'm usually suturing. I'm usually helping suction, making incisions, and so that's basically my 9 to 5, Monday through Friday.
Yeah. That's
Yes.
awesome. I could see like people sometimes they'll say to me like, "Oh, I couldn't be at the hospitals doing what you do," but I don't think I could be in the OR. Like, I just don't think.
No, I think
I
you could,
remember.
Shane. We got to bring you over. We got to bring you over.
I remember my
Yes.
first. I think I'm scarred. My first day of rotations. I remember I
Uh
had
huh.
a surgeon. He was like the nicest surgeon, general surgery,
Yeah.
and he had me hold the camera, and as a student, right, you
Oh
just
yes.
don't know how to work it, like, you're just and
Yes.
he ended up, like, perfing a gallbladder that day, and,
Oh
we were
no.
we were in the OR for hours cleaning out the
Yes.
abdomen, and I just remember him just every word in the book, and I think
Yes.
that, like, scared me, but then afterwards, he's like, "Oh, no, you did fine, like, it's okay, it's just"
Oh,
but
good. Yeah.
but,
Yeah.
yeah, so I being in the OR after that, I always was hesitant, but maybe one day, we'll see. I like what I do. I like the
Yeah.
sepsis. I like the AFib. Um,
Yes, you can definitely do that. You can definitely do that. On top of that, I have a funny story. I think I've told my other PA students this, but during your clinical rotations, sometimes you will not like your rotations, but you end up doing it. So
yeah,
I'll dive into this. My students always ask me, "How come you pick surgery?" I actually knew I always wanted to do surgery. Um, Entering PA school, I knew that I wanted to use my hands to help people, like my physical hands. I think it's just satisfying when a patient comes in sick, you can do some surgery and they're better. But
yeah,
during my rotation, just similar to yours, I had a preceptor that was kind of scary, kind of difficult. I learned a lot, of course, but
yeah.
I dreaded my surgical rotation. But ultimately, in the back of my head, I was like, you know what? You love surgery. You love surgery. You're gonna love it.
You
There were
talked
many days
yourself
where I
into
doubted
it.
that. Exactly. No, there were many days I doubted it. I was like, do I really like this or not? But I knew that all of that grit, all of that toughness that he was putting me through just made me a better person at the end of the day. But yes, there would be definitely rotations that you are like down yourself, but at the end of the day, you're like, you know what, I made it, and now I'm doing surgery.
That's
So
you know
yeah,
what? I couldn't have said it better myself. I you
yeah,
know, when you talk about surgery and kind of lessons that you learned, what advice would you give to some student that's watching this that wants to go into plastics? Like, is there anything specifically that you would say to them? Hey, do this or think about this if you're wanting to go
yeah.
into the field.
I would definitely say build a solid foundation on your anatomy. Um, know your wound care stuff, and I think specifically for plastic surgery, patient communication. It's all about face to face. It's all about building a patient um, healthcare worker relationship. Um,
Yeah.
it's yes, it's medicine, but also you have to be patient with these patients. Sometimes they don't fully understand. They just want to go in and automatically, you know, have a 180 change, but it's not always like that. It's not always easy. So you have to sit down and explain to them, these are the steps to get to your end goal. And so it's always about those things, three things I said. I say, know your anatomy, know your wound care, and have a good patient relationship.
I love that. I mean, I think the one
Yes.
point that you brought up was the patient communication. It
Yeah.
blows my mind how often that's forgotten. I don't think people
Yeah.
recognize, like, we'll go into rooms, we're so busy. It's kind of the system, right? The pressure that's put on us to see patients do things. But we'll
Yes.
go in, talk to a patient, and realize we didn't even explain anything, or we didn't even give them the information. I mean, we try not to do
Yeah.
that, but it happens to
Hmm.
all of us. And so I talk about this a lot in the hospital because in the hospital, people are very scared. People are usually very
Hmm.
sick. And it is imperative to make them understand their clinical course. It is imperative so they know
Exactly.
what to expect. And I just
Yeah,
wanted
I
to
agree
kind
with
of
that.
just touch on that because I don't think enough people do it. Hell, I think
Hmm.
PAs particularly have a strong sense of, like, that's, like, beat into
I
your
was just
head
gonna
as a
say that.
PA. Like,
Yeah.
always communicate, document, that kinda stuff, but, yeah, I think that that is one of the, if not the most important thing you brought up, is the communication part of it.
Yeah. I agree with that and I stand by that 100%.
Yeah, 100%. And so going off of that from communicating to your patients, this is a little bit different, but we had Josh on here last week, the gastro ginger
Yes.
PA, and he
I love
killed it.
Josh.
Josh
Yes.
was awesome. Josh was awesome. Um, but we were kind of talking about how he had emphasized how it was putting content out and how it's so important to communicate to patients that way. What inspired you to start making content? What inspired you to get online and say, you know what, I'm going to start posting my stuff. I want people to know about what I'm doing.
Yeah. Yeah. This is a great question because we actually had this conversation with my other friends. And so it stems back to the very beginning when my first opening fact. I should have hid that surprising fact, but you already know it. So I was a child actor back in the day. And so because of that, I always had a passion for creativity and, like I said, storytelling. And so when I got older, yes, I was so focused with my studies, like in undergrad, in PA school, I was so focused on studying and getting A's and passing my exams and everything that I kind of lost myself. I was like, wait a minute, I'm just so focused on the education aspect that I can't even have fun anymore. And so because of
Yeah.
that, I was like, you know what? Let's try to do some fun content. So at first, it was very just fun, lightheartedness content, Um, but then I realized, you know what? I'm gonna use my content for good. So I was like, you know what? Now that I am a PA student, I started, around PA school time. I want to share my experiences. I want to share what it's like to get into PA school and how to become a PA. And so that's how I gradually got into building my content up. So yeah, I think it's good to be professional and focus on your education, but also have a hobby, a creative hobby. So for me, it was storytelling, performing, and so um, that's how I got into content creation.
Yeah, and you've done a great job of kind of mixing things, and I love how we've all kind of evolved. I mean, we were talking off
Yeah.
camera before we started the podcast, but me and you, we've been
Yes.
following each other for years, and then just never, like, this
For
is our first time
years.
actually talking. Um, but
Yes.
it's awesome to see the growth, and it's funny because when you start, it's like that awkward kind of cringe period where, like, people are like, "Oh, you're
Yes.
making videos?" Like, "Oh," and
Yeah.
now it's like,
Yeah.
and now I really just, it's part of what I do, like, and I just enjoy it
Exactly.
so um,
Yeah.
particularly to your content,
Hmm.
when I look at your page, it is a mix of so many things. It's a mix of in a good way, the
Yes. Yes.
medical,
Yes.
aspect, but there's a lot of humor injected into
Hmm.
that, and then also, like, your personal life, and I love how you make sure that that is, seen through your content, that you live outside of the hospital walls. I think some people, they all their content is just boom, 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 medical content. But no, you actually
Yeah.
show you living your life. Can you tell me kind of how you mix your content around travel in your personal life
Yeah.
and medicine?
So I really wanted to incorporate every aspect of my life and just showcase it to PAs, PA students, or just any viewer out there. So yeah, at first it was all kind of like PA stuff. And then I was like, you know what? I actually have a background in acting and dancing. Why don't I just dance a little bit? And then I was like, you know what? I also, like to travel. So let me share a little bit about that. But I think what really resonated with lots of my viewers is actually sharing my cultural side. So I am Vietnamese. I'm a first generation Vietnamese American. And so because of that, there's a lot of pressure out there because in the Asian community, we have parents always telling us, "Hey, you got to be a doctor, you got to be a lawyer." But why not a PA? So I was like, you know what? Let me share my story on how I became a PA. And so I incorporated more of my Vietnamese culture into my content, specifically teaching medical content translated to Vietnamese. And I think that was the thing that really made me feel like I'm doing something great here because the feedback was just amazing. I had so many dentists, I had pharmacists, doctors, and of course PAs that would comment and reach out and be like, "Hey, I didn't know that that's how you say fever in Vietnamese," or "I didn't know that that's how you say hurt or pain in Vietnamese." And so I think that's what was so special because a lot of the Vietnamese community, we have older and elderly patients, and yet us as younger Vietnamese healthcare providers, we got to communicate, And so when you can translate medical terms into Vietnamese and deliver it to, the elderly patients, I think it really bridges the gap between the medical literacy. And so I think that's what's important. And so, yeah, what I just touched upon, those four things, that's what I try to focus my content on. So, PA, dancing and humor, travel, and my Vietnamese content.
That's awesome. I mean, it is so cool to see how much reach you have just from the broad diversity of content that you make. And you know what? It's so funny because my first job, my best friend at my first job, she's
Yeah.
Vietnamese. And so
Okay.
I learned a lot about just like the culture in general from working so closely with her, became great friends. And it's
Yeah.
awesome. People are so friendly. It's so fun. And,
Yes.
she's been trying to pull me to take a trip to Vietnam. And so
Oh, Shane, you would love it. You would love it.
uh, well,
Yeah, no, the people there are nice, the food is amazing, and so you need to go. Better
all
yet,
right.
me and you should go, and we'll go over there and we'll make some content. Yes.
We'll do it, okay, I'll tag her in the comments below. We'll do shout out to Jess, so she'll see this, and
Yes.
then we'll get us all on a plane. I think it's
Yes.
24 hours from Pittsburgh. So
No way.
it'll be a journey.
That's like a whole
Yeah, I think it's
day.
20.
That's insane.
Yeah, because you're on the other side, right? So,
Yes.
yeah, how far is it for you?
For me, okay, so there's always a layover. There's a layover in Japan or Hong Kong or Korea. And then so from here to there, it's 12 hours. And then from
Okay.
there to Vietnam, it's another 6 hours, I think. So in total, it's
Wow.
around like 18 hours.
Okay.
Yeah.
Yeah. So, wow, that's yeah, that's a journey.
It's a
Well,
long trip. It's a long trip. It's across the Pacific Ocean.
worth it. It's worth it.
It's
Um,
worth it. It's worth it.
okay. So I think one thing that I also wanted to touch on is your travel specifically, because like you, I love to travel. I'm maybe not as
Yes.
well versed as you are, but I'm getting there. I'm going to catch you. Um,
Yes.
and so I wanted to ask this because you kind of alluded to it a little bit with, your portion of your content kind of, reaching to your Vietnamese speaking followers. But how has being a world traveler affected your healthcare practice? How has it made you a better provider?
Yeah. Well, let me start here. I think that me traveling stemmed from my parents. So I want to say thank you to my parents first. they've always been travelers at heart. Whether it was so I remember as a child on the weekends, we would always go out to do stuff, like just simple stuff like go walk in the park, go to the beach, go visit a museum. And so we're always on the move. Like me and my family, we can't sit still. We have a problem. And so because of that, um, now that I'm older, it's just natural for me to go out and travel and see the world. And so because of that, I think traveling has really taught me, the importance of perspective, adaptability, and like cultural awareness. I think that a lot of healthcare providers, yes, we have a diverse group of patients, but sometimes we're not culturally aware on how to be polite or like certain etiquettes. And so for me, being able to travel the world, I've been seeing so many different cultures, so many different foods, so many different languages. And so I try to incorporate that into my practice. So it doesn't matter what religion, what race, what gender you are, what you believe in. I treat all my patients the same. Um, and yeah, I think that's what's important.
100%. I don't think I could say it any
Yes.
better myself. I think even, like, from traveling, you can kinda see how different the rest of the world does it from us in the States.
Yes.
Um,
Yes. Yeah. Yeah.
I remember I remember specifically, I was in Switzerland, and I was with another PA where we don't exist in Switzerland.
Okay.
Like, we're not PAs, I don't
Okay.
at least from my knowledge, they're not there.
Yeah.
Um,
Uh huh.
and I remember we were getting on the plane to go back to the States, and
Hmm.
she was like, "I wanna go and get some, like, melatonin over the counter to sleep on the plane because I can't sleep and I wanna
Yeah.
sleep."
Uh
I
huh.
was like, "Okay." We go to the pharmacy and we go to get melatonin off the shelf, we go to buy it, and the
Yeah.
pharmacist was like, "Nah, you don't need that." And we were like, "What?"
Okay.
Like, and they're like,
Yeah.
"Nah, like, we're not gonna sell that to you, you don't need that." And so, like, we didn't realize
Interesting.
that, like, over there, like, the pharmacist will, like, basically kinda, like, direct you if you need something or you don't need something.
Oh,
Yeah, and
gotcha.
so
Okay, that is interesting.
yeah,
That
so,
is
like
very interesting.
yeah, and so it's like one of those things that we just never even thought about, but since you travel,
Yeah.
you start to see how different places do it, so really
Well,
cool.
yeah, even in I wanna say Europe and even in Asia. So, I remember when I went to Vietnam, there were pharmacists over there, and it's very interesting because, um not for me personally, but a family member of ours had a stomach ache. And, like, naturally, you just go to, like, a CVS or something or a Walgreens, grab something really quick. But I remember at this point, the family relative told us just to go to the pharmacist, and we were like, "To the office? Like, that seems like a lot of work to get an appointment, sit in the waiting room," and, like, "Wait, I'm
Yeah.
confused." So, in Vietnam, there's actually pharmacists that have their own kinda, like, booth, kind of like a food stand, to be honest. It's like a very, like, makeshift booth, and you go there, you tell them your symptoms, and they'll just give you medication, and I thought that was so wild and so different, and so,
Wow.
similar to you, yes, there's pharmacists out there that just go out and they'll try to explain to you what you actually need.
Shout out to all of the pharmacists all over the world.
I know, really
What
though, shout out to
would
the
we do with
pharmacists.
what would we
Yes.
do without you? Um,
Yeah.
um, okay, so we kinda covered a lot. I wanna dive
Yes, we
into a little
did.
bit I wanna dive a little bit into the PA profession as a whole, because there's been a
Okay.
lot of I want to say controversial things. There's been a lot of changes around the profession recently. You
Mhm.
just got back from AAPA. We saw you guys living it up in New Orleans. It looked like a great time.
Yes.
I'll be there next year. I'll join you guys.
Please do,
But
Shane. We gotta get Shane over to Phoenix. It's gonna be in Phoenix next year, everyone. Go.
yeah, everyone go to Phoenix next year. I'll see you guys there, me
Yes.
and Patrick.
Yes.
Um, so
It's gonna be
can,
awesome. We're gonna have a great time, you guys. Come.
can you kind of after going to the conference since I missed
Yeah.
out, can you kind of talk about where you feel the profession is heading, some the biggest challenges facing the profession in the coming months to years? Like where do you see 1 year, 5 years down the road the PA profession going?
Yeah. Um, so I think that it's gonna even get bigger and bigger, but I do wanna touch upon this. I think the one major thing that everyone's talking about right now is definitely how we are not labeled as professionals. I think that's a really major no-no. Um, it's affecting our care for our patients. Um, our population is just growing. Our population needs the care, and so without PAs, all these patients, all these people are not going to get the quality care they need. On top of that, it's harder for students to become PAs because of the student loan situation. And so I think that's a major thing that we need to change. We need to speak up. We need to, uh, voice our opinions out there and hopefully get some change, you know? Um, what I really hope for the future on a positive aspect is, like you said earlier, we are physician associates. We're trying to make that change because I think with the name assistant, lots of patients think that we just assist. We just help. We hold things and we bring coffee, but we're much more than that, right? We diagnose, we treat, we do surgery. And so I that's why I hope for the future. I really hope that we are identified as physician associates and we get a bigger say and a bigger role in the healthcare world.
Yeah, no, I'm glad that you brought it up. Maybe I was doing a little bit of fishing because there's a lot of controversial things that are coming up, but I'm glad that you spoke to it.
Yes.
Um,
Yes.
particularly, yeah, I agree. The degree is a very hot topic right now, and kind of where it
Right.
stands not being
Yes.
counted as a professional degree, and major PA organizations are now suing the federal government to revoke
Yes.
that. Um,
Yes. I just saw that too.
yeah, and
Yes.
as a from my own personal experience, I'm a first generation college student. Like I
Yeah.
never had anybody in my family go to college.
Yeah.
And
Same here. Same here, Shane.
yeah. And so there is I understand the expense that PA schools have. They're very expensive programs. Also,
Yes.
anatomy labs, cadaver labs are very expensive.
Yes.
Going on clinical rotations are very expensive. So the price of
Yes.
programs kind of fit those expenses. But
Right.
with that, there is already a gap, like a physician shortage, right? And like
Right.
we're not physicians, but do we fill that gap? We certainly do. And making this degree not accessible to people like yourself and me, who are obviously capable, right? We were able to go through the school and go through the program.
Mhm.
But if we existed today and we're going to go to school today, there's no way I'd do it. I would never be
Right.
able to do it.
Right.
And so
Yeah.
you have quality people that can't contribute in an area that is desperately in need of providers.
Yes. And especially too, so for those who are listening, Shane and I, we're living in, I would say, cities, right? But for those that are living in, the middle of America, in the rural parts of our country, it's going to be even harder to seek care because there are no providers out there. And so that's a major concern as well.
Yeah, and that's a great point too. I mean, so you're in California, I'm based in Pittsburgh. Pittsburgh,
Yep.
I don't know if you've ever been to Pennsylvania, but it's the city and then it's nothing. Like it's
Yes.
woods and then it's Philadelphia.
Uh-huh.
Um,
Got it.
and
Okay.
and so where I rotated was in very rural communities, and then I did
Yeah.
the health core scholarship for a couple years in
Oh,
underserved
nice.
communities. And so
Yeah.
I mean, when you say access to care is could be, 45 minutes away because there's no one else
Yeah.
there, it's
Yeah.
insane because you don't see it until you're in it. No one realizes
Right.
it until you're in it. I had people that would try to pay for their annual visits with like fruit and produce. Like
Yeah.
seriously.
Yeah.
Um,
Yeah.
and so we need PAs that are willing to fill those positions, and by just defunding the degree and also just like the disrespect, like let's just call it what it is, the flat
Yeah.
out disrespect
No.
to the profession.
Yeah.
Um,
Yeah. I agree.
it's
I agree.
it's just disheartening, and it's certainly not progressive as far as for the profession or for healthcare in general. So
Yeah.
make sure you
I
know who
highly
you're
agree
voting
with
for.
everything you said. Exactly. Make sure you know who you're voting for, but also voice your opinion, right? We have congressmen, we have mayors, we have people in other um, aspects of our government that can
Yeah.
actually help us out. And so, voice your opinion to those um, in higher government positions as well. Yeah.
Yeah. Yeah, 100%. And I think that too, people in general, like, there's been a lot of negativity towards healthcare professionals ever since COVID. At least I feel that. Not
Hmm.
always, but um, the people who are in it, who are in this big machine that is the healthcare system, like, we really care. We're not the
Yes.
bad guys. Like, we all really
Yes.
want the best. And I think that sometimes we're the faces of it, right? Like, we are the faces of
Yeah.
this machine. And so we're associated with those bad things. But the people that are doing it, we care a lot and we don't want any fights. We don't
Yes.
want any harm. We want to do good, be
Right.
good. That's why we all took the oath, right? Um,
Yes, exactly, the oath. And also,
eh,
like I said earlier, it doesn't matter what background you are, what ethnicity you are, what side of the fence you're on. Um, it doesn't matter anything. I'm here to give you the care you need, and I treat everyone the same. And so at the end of the day, we're just trying to make the world a better place and make sure that everyone is cared for.
Absolutely. Absolutely.
Yeah.
Um, so, kind of pivoting from this this more like negative and kind of, serious
Okay, yes.
topics.
Let's try to lighten it up. Yes.
Try to lighten it up a little bit, right?
Yes.
Um, so we talked about kind of where you think the PA profession's going. I
Mhm.
wanted to ask you specifically, what do you hope that people take away from your work as a PA and then your work from your content? Like, what do you hope that people take away from what you're doing in your day to day job, but then also what you do on social media? Like, what do you hope that people get from you?
Um, I think the first thing that I want to represent is definitely my Vietnamese culture. That's how I'm born. That's who I am. I'm Vietnamese American, and I really want people to see that. Hey, if he can do it, I can do it. All right. There are, of course, tons of jobs out there. But for me to share my own personal story about becoming a PA, I hope it resonates with people. And I hope that people can be like, you know what? If he's a first generation American that has gone through undergrad, through PA school, and has gotten to where he is now, hopefully I can do it too. And so I tell everyone this: send me a message, right? If not a message, send me an email. Okay. I'm going to help you guys out the best way I can. And then the second thing too is I think with plastic surgery, I really want to, make sure that everyone understands that plastic surgery is not just cosmetic and beauty, right? It is medically necessary for certain people. And so hopefully if I can resonate those two things across, that would make just my day. I could sleep well at night.
Yeah. No,
Yeah.
that's awesome. That's awesome. And so, I always kind of ask people to like on a more of a closing note for the
Hmm.
episode. If there's
Yeah.
one thing that you could leave the listeners with, one message, whether that's to PA students that want to do what you do or just your general audience, is there anything that you'd want to leave them with?
I would say this. I would say that for any listener out there, whether you're a PA student, a PA, or just a listener, listening on our amazing conversation, whatever background you're in, make sure you know who you are, and you should feel inspired to pursue your goals. Yes, you can be a healthcare provider, a teacher, a lawyer, but you can be many other things at once. I'm a PA, and yet I'm a traveler. I'm a dancer. I'm an actor. I'm a son. I hopefully can be a brother to all my PA friends out there. And so you can be so many other things than just being, one singular. Like I don't want people to get stuck in a box. We sometimes we forget who we are when we are placed in a box, and so don't be afraid to step out of the box. Reach for other goals and aspirations, and you never know, you might just reach those.
I love that message. And I think that that can resonate with a lot of people too, because one thing we always ask people, right? We ask, what do you do? What do you do? And
Yeah.
the first thing
What do you
people
do?
say is their job. And I'm like,
Yes,
no,
that's
what
so
do you
true.
do? What do you do? Do you
Yeah.
travel? What do you like for fun? Especially when I
Yeah.
meet people in the hospital, I talk to patients. I'm like, what do you do? What do you do for work? And they
Yeah.
say it. And they're like, yeah.
I'm the
But I'm
exact
like,
same. I'm the exact
yeah,
same.
yeah,
Yeah.
you
I
don't want to be in that box.
Yeah, you don't wanna be in that box, and also, I always tell my PA students this. Here's a bonus tip if you're any PA students listening out there. When you open up a statement, like what Shane said, yes, you're a student, or yes, you're a PA, but you should continue the sentence with something interesting, because it actually opens up a conversation. So that's why, if you notice in the beginning, I said, like, yeah, I swim, I go to the gym, I'm a dancer, because it triggers something in the listener's brain to be like, wait a minute, he's not just a PA. He's actually X, Y, and Z. And so if you PA students can actually, oh, sorry, pre PA students can say that during your PA interview, it will create a conversation with whoever's interviewing you.
Yeah,
That's a
absolutely.
tip.
And this is high value for the end of the episode because
Right,
because
right. We went
y
all this way to give you an amazing tip.
because yeah, I mean, you're somebody who's taken multiple students. I've precepted multiple students, and I
Exactly.
still text like admission committees from my university. And like
Yeah,
I think that what people who are applying to PA school don't realize is they're like, I have this 3.6 GPA, or I have this
yeah,
313 GRE score. No, you're not. Like, we are trying to build a cohort of people that will work together and pass the test. That's what we're trying to build. So
yeah,
I want to know
yes,
about your hobbies. I want to know that you're a normal functioning
yes,
human being outside of just your
yes,
academics. And it's like, please,
yes,
please say that. Like, please talk
yes,
about
please
you.
do.
And
Yeah,
it makes a huge difference. And so I appreciate you bringing that point up too, because I think people will get a
yes,
lot of value from that.
yes,
Well,
yes.
well, Patrick, I just want to start by saying thank you so much for coming on the
No,
podcast.
thank you,
I
Shane.
I really appreciate it, and I'm super excited for kind of what's to come. I know that people are gonna love this episode. I know that if you're listening to me on YouTube, check me out on Instagram at the Pittsburgh PA. I'm also gonna link Patrick's page down below as well, the PA Patrick.
Awesome.
Uh, and
Yes.
get us on TikTok. If you're listening on Spotify, do the same thing. I'll put the links down below. But I am so happy to see that we are getting it out there to people and having wonderful guests like yourself come on. So thank you guys. And I'll see you guys in the next video.